Good morning, everybody. Dr. Vasquez here, coming to you live to talk about part number 2. And this is going to be part number 2 out of parts 1, 2, and 3. So I decided to add at least one more section to this short series on injection-induced psychosis. So I started this yesterday. Obviously, it was it was totally spontaneous, except for the fact that I know quite a bit about neuroinflammation. So that's the model or the biological plausibility behind all of this, apparent connection between certain injections and psychiatric illness. So yesterday I started a review of about 22 articles, and today I'll finish that review of 22 articles. And then in part number 3, I'm going to kind of take this whole conversation to the next step. And I just thought of that this morning, but I think that will be a worthwhile conversation, mostly for the doctors in the audience, especially doctors who specialize or see a lot of patients who have psychiatric problems or mental problems. I think that the part number 3 of this conversation is going to be pretty interesting. So again, the conversation is injection-induced psychosis. I've actually known about this for many years, but let me give you the example of what I'm talking about. And I'll try to put this in the video, assuming reasonably that I can find it. So many years ago, and this is probably like 10 years ago, I believe is when I first became aware of this research. So I'm gonna assert that this is at least 10 years old. But I saw a few articles where the investigators had used vaccination as a way to create brain inflammation, as a way to create, therefore, depression and anxiety. So we could call that a iatrogenic, inflammation-induced mental disorder or psychosis, or at least depression and anxiety, not full-blown psychosis. But my point in bringing that up and reviewing that is that this is an established model of creating mental illness in people. This isn't like some radical new idea. It's like, oh wow, they just discovered that the COVID vaccines could cause depression, anxiety, and occasionally psychosis. I mean, I appreciate that this is probably new information for most people. I appreciate that. But in the world of research and neuroinflammation and neurobiology, this is not news. This has been published. This is an established model for creating mental illness, and it happens to now be, implemented on a international scale that we've never seen before. That's the part that I think captures my interest in this topic right now. If a few people become anxious, depressed, or psychotic because of a now and then vaccination, it doesn't have a global impact. But if the global population is mostly forced to receive an injection that also happens to be consistent with a model for inducing depression, anxiety, and psychosis, then we have to look at that same topic, but on a much grander scale. So again, as I introduced yesterday, I've already talked about most of these mechanisms in my book, Inflammation Mastery, and I referenced that book yesterday, and I'm going to reference it again right now because some of you are seeing this video, part number 2, and you haven't seen part number 1. So we're going to look at Inflammation Mastery, 4th edition, page 937. And on this page, on 937, as you can see in this diagram right here, I talk about the mechanisms of neuroinflammation. And I reviewed this yesterday in my rather spontaneous and hypoglycemic video that I did yesterday because it was like 4 o'clock in the afternoon and I hadn't eaten anything. So that's why I cut it short at about 50 minutes. Let me see. I'm looking at an article right now that I'm going to review, but I want to see if the last page maybe has some blank space for me to write, and it does. So I'm going to write on this page what I said yesterday, and then again, I'll verbalize this again for a second, or maybe even, I guess it would be the second time. I'll verbalize it again, but the second time that I verbalize what I'm about to draw, I'll show you the image from the book in better resolution so that you can actually see exactly what I'm talking about. So, and the reason I'm drawing this out, and the reason that I like to draw things out, is because what I'm demonstrating to you when I draw things out is that you can understand this and you can master this, and you could draw the same diagram that I'm drawing. You just have to have the knowledge. And so what I'm trying to do is not only give you the knowledge, but show you how easy it is to draw the stuff out. So let's do this. I'm going to draw it out, and then I'll verbalize it a second time, but showing the image from the book. And I'll do that when I'm editing the video. And then we'll get into the review of this. But I want you to understand the biological plausibility of what we're talking about. Because, like I said before, if this happens rarely to a few people who happen to have an adverse effect from a vaccine, that's one thing. But when a vaccine is forced on the entire global population, and it also has adverse psychiatric effects like depression, anxiety, and psychosis, then again, we have to take this concern more seriously, in my opinion. So let's start. I'm going to do this slightly differently from how I did it yesterday. But I'm going to use microglia as a model. So yesterday I mostly talked about microglia as the major players, and they still are the major players, but they're not the only players. So let's talk about microglia. And remember what I said yesterday, and what's also in the diagram in the book, is that these are the resident immune cells within the brain. So your brain isn't simply neurons. Your brain's about roughly 50% neurons, and then roughly 50% what we call glia cells, and those are the glue cells that hold your brain together, and those cells perform certain functions, such as creating the blood-brain barrier, immune function like the microglia, support cells like the astrocytes, and the oligodendrocytes, which form the myelin, or the sheath or the covering or the insulation around your nerve cells. So again, remember, your brain's about 50% neurons, and the other 50% are support cells. And some of those, if we're going to say support cells generally, then some of those are immune cells, blood-brain barrier, oligodendrocytes creating the myelin sheath around the nerves, and also astrocytes. Those are the main cell types, but they're not the only cells. So in addition to microglia being the immune cells of the brain, we also have infiltrating monocytes, for example. Those are immune cells from your bone marrow and then the blood, and those can enter the brain in times of distress and actually make things a hell of a lot worse. Other types of immune cells can enter. I'm assuming lymphocytes can enter, but specifically mast cells can also enter. So you've got a few mast cells in your brain. Those are inflammatory cells, most famous for creating histamine, but they certainly do a lot more than that. But those can also enter the brain. So basically, you've got a team, let's say, or a group of immune cells, and those can, perform some beneficial functions, but mostly, for most normal, healthy people, it just creates problems. So when the microglia get activated, remember, these are the immune cells of the brain. When those microglia get activated, they are going to create cytokines, because that's what immune cells do. And they're also going to create more of an excitatory neurotransmitter called glutamate. And that's what we're concerned about here. So glutamate's a neurotransmitter. So obviously it is going to have an effect on neuronal cells. So let me just say one more thing, because I already mentioned it. Cytokines. So I told you that obviously the microglia create cytokines. And we could almost say cytokines as kind of cytokines are obviously a group of, inflammatory mediators, but they're not the only players in this. The microglia are also creating other signaling molecules that have effects within the brain, both on the same microglia. So it's kind of an auto feedback loop on the microglia. But ultimately, one of the things we're concerned about is the effect that the microglia have on astrocytes, which I already mentioned. So apparently microglia produce glutamate, but the astrocytes have the job of recycling and obviously therefore kind of cleaning up excess glutamate. However, in times of inflammation, the astrocytes fail to do that job. So while the microglia are producing more glutamate, the astrocytes fail to recycle or uptake that glutamate. So you end up with a hell of a lot more glutamate. And as I mentioned yesterday, glutamate is the main excitatory neurotransmitter within the brain. You've probably got like 10 or so different receptors for glutamate within the brain. The categories of those glutamate receptors are divided between ionotropic and metabotropic, and both of those are important, but the ones that we're mostly concerned about are the ionotropic glutaminergic receptors, glutamate receptors. Of the 3 different types of glutaminergic receptors, the ones that we're really concerned about are what are called NMDA receptors. Because when those NMDA receptors get activated, they form an open channel for the entry of calcium, and calcium within the cell acts as a second messenger and basically creates a lot of hell. So low levels of NMDA receptor activation are necessary for learning and normal function of the brain, but when we have too much activation of those NMDA receptors, too much calcium enters the cell, calcium functions as a second messenger. In times of intracellular calcium overload, which I have described as intracellular hypercalcinosis in an article that I wrote back in 2006, so that's almost 20 years ago. When that happens, a bunch of hell starts breaking loose, and the cell, whatever the cell is, and it could be a cardiomyocyte, it could be a neuron, whatever, but whenever this happens, the cell basically starts to enter into a death spiral. And at that point, recovery, oxygen, and nutrition becomes obviously very important. So the microglia produce the glutamate. Astrocytes say, "Hey, we're not picking up all this glutamate," and that activates the glutamate receptors. The one that we're mostly concerned about is the NMDA receptor, because that's the one that's on neurons. And if you lost a few microglia, you probably wouldn't care. If you lost a few astrocytes, you probably wouldn't care. But if you start to lose neurons, you're going to start to care really fast, because that's called neurodegeneration, and that's what leads to conditions like Parkinson's, Alzheimer's, and other types of neuropathology, but ultimately leading to impaired brain function. And what does that ultimately mean? Impaired cognition and impaired movement. Impaired cognition, dementia, like Alzheimer's. Impaired movement, obviously, like Parkinson's. So, again, that's the biological plausibility of what we're talking about here. And depending on which region of the brain is inflamed, that's what's going to create, the outcomes. If it's inflammation within the spinal cord, we call that transverse myelitis. If it's inflammation within the deeper brain structures, that could create behavior abnormalities or movement abnormalities. If it's inflammation of the cortex, then it could be all the way from paralysis to cortical blindness to other type of cognitive problems, including vegetative state, catatonia, schizophrenia, things like that. So let's see, I wanted to talk about one more thing. So let's go back and talk about, what would cause all of this? What would cause the microglia to become activated? And it could be anything. But any type of trauma, any type of inflammatory or infectious insult, and that's not only what vaccines do, that's what they're designed to do. Vaccines are designed to create 2 types of inflammation. One is specific, or so-called adaptive immunity, the creation of antibodies, but the other type is non-specific inflammation. All vaccines are designed to create non-specific inflammation to augment the specific adaptive response. So that's why I'm sure you've all heard of the term adjuvants. That's why vaccines contain adjuvants. And even in the newer technology, so-called vaccines, the mRNA vaccines, vaccines always have some level of contamination, and those contaminants commonly act as adjuvants, whether they're intended to act as adjuvants or not. So, again, the vaccines are going to cause an inflammatory response. They're designed to do that. They're intended to do that, and that's what they do. Some of that inflammatory response is going to activate the microglia. That's going to increase glutamate. That's going to activate the astrocytes. Astrocytes aren't going to pick up the excess glutamate, and then you're going to get excess NMDA receptor activation, and we call that neurotoxicity. That's one of the metabolic and inflammatory components of neuropsychiatric illness. So, that's the quick summary. Let's see. I said I would repeat it just for the sake of showing you the diagram directly from the book. And I just said it right then, but again, we go from any type of insult. It could be stress, it could be trauma, it could be a boxing injury, it could be soccer injury, it could be a car accident, it could be fast food, it could be in some type of medical injection that's going to activate the microglia, that's going to activate the astrocytes, that's going to lead to excess glutamate, and that's going to excessively excite and potentially eventually kill some of the neurons. Excess glutamatergic neurotransmission also promotes seizures, so you'll see probably in some of these case reports the spectrum that you would expect if this were an academic continuum, so to speak. You would expect depression, anxiety, psychosis, seizure, and then probably some level of permanent brain damage from excess excitation. So let's look at this article. Now that I've talked about biological plausibility and kind of the background information, let's just look at the articles just like we did yesterday. And again, I'm going to post all of these articles on the website so you can have all of these PDF articles. The number of articles connecting psychosis with the COVID vaccines is, I found about 50 articles yesterday when I looked for this topic. Of those 50 articles, I was able to download about 22 of them. So almost half of the articles, and I'll put these on the website. So let's look at this one from Molecular Psychiatry. This is one of the Nature journals. Nature journals are some of the best journals. That doesn't mean they don't publish some garbage now and then, but they're pretty good journals. Anybody would be pleased to get published in the Nature journals, including me. And I have been published in the Nature journals. Back in 2016, I published a one-page article in Nature Reviews Rheumatology, and I'm quite pleased with that article. Actually, the topic of that article was fibromyalgia, complex regional pain syndrome, and neuroinflammation, which is exactly what we're talking about right now. So let's go very quickly through this article. Psychiatric adverse events following COVID vaccination. So I'm going to post the article. This is just a quick survey to kind of look at the research, but let's just see what they say here toward the end. COVID vaccination increased the risk of depression, anxiety, dissociative disorders, stress-related disorders, and somatoform disorders, and sleep disorders, while reducing, they say, the risk of schizophrenia and bipolar. That's kind of surprising. But let's see. Let's go another line up. Schizophrenia, and so they say, looking for my highlighter, schizophrenia and bipolar disorder showed a lower cumulative incidence in the vaccination group than in the non-vaccinated group. So I have to go even farther up and see if this was totally observational. It looks like it was. So this is a insurance service claims database. So this is not a controlled trial by any means. They're just kind of looking at what happened in the population. We gave these people the vaccine, and then let's see what happens. Let's see what falls out. So the problem with kind of cohort population studies like this is that we don't know what other factors were at play here. So we're looking at two variables. We're looking at who got the vaccine as one variable and what their outcome was as the other variable, but we don't know if other variables were at play. So we still get some data, but it's not like perfect data. But nonetheless, a 60% increased risk of depression, a 40% increase in anxiety, dissociative disorders. That's getting pretty psychotic. So depression and anxiety can be mild, and they usually are mild, but they're not necessarily categorized as psychosis, unless it's really severe. But dissociative disorder is psychotic. Stress-related and somatoform disorders increased by 40%. Sleep disorders almost doubled. Increased risk after COVID vaccination. But somehow they come up with a lower risk for schizophrenia and bipolar. Well, I don't know about that, but that's what they found. So anyway, you can look at the details of this article if you're interested. And it's probably doing that because I closed out the internet. Sorry, I'm gonna I'm going to reorient my slide, which means I'll have to edit the video a little bit when I get to this point because I want to make it horizontal. So let's see, where do we want to go with this one? Let's just take a look at it. Let's see. Oh, so this is a preprint, and that's fine. Broad spectrum of non-serious adverse events following COVID vaccination. Again, this was in Seoul, Korea. Let's just see what they found. So I'm not going to give this one a lot of time. Vaccination significantly increased the risk of all the non-serious adverse effects except for visual impairment. So basically they found some problems. I'll put this on the website. I'm not going to spend time on it right now. Central nervous system immune-related disorders after SARS-CoV vaccination, a multi-center study. I don't think I looked at this one yesterday, even though it's from, the other one was another Frontiers journal, but this is Frontiers in Immunology 2024. Let's see what they found here. Yeah, so I'll mention something again today that I mentioned yesterday. CNS adverse events of COVID-19 vaccination appear to be very rare, even at specialty centers, and consist mostly of antibody negative AE. Let's see what their AE stands for here. Autoimmune encephalitis. So it's a cell-mediated, and that is what you would expect. It's a cell-mediated autoimmune encephalitis, myelitis, and acute disseminated encephalomyelitis, developing approximately 2 weeks after vaccination. And then here's the clincher, so to speak. Most patients, not all of them, most patients improve following immunomodulatory treatment. Well, no surprise there. They're going to, most likely, they would improve anyway. But just like I said yesterday, you'll notice that they say these patients improve with drug therapy. They don't get back to normal. So a lot of these patients who improved after they had vaccine-induced paralysis or vaccine-induced spinal cord injury or vaccine-induced brain injury, yeah, they improved, but they still might be mute. They still might be paralyzed. So I'm bothered and irritated and frustrated when medical researchers use kind of Pollyannic or positivistic language. Oh, the patients improved with drug therapy. Yeah, but let's get real. They were probably going to improve with time after the initial insult. But again, a lot of these patients will be permanently impaired. So let's just see real quick what they found. They don't really mention. They don't mention the clinical outcomes. They just say what they did. That's too bad. Brain injury, spinal cord injury. Let's see what N says, because that was kind of a deeper. No, they don't even mention it. But I thought they were going to say something about like the deeper brain structures. Well, I'm sure this article has its merit, but I'm not going to spend a lot of time on it. You're welcome to take a deeper look at it. Let's look at this one. Frontier Psychiatry, 2024. New onset psychosis following COVID vaccination. Hopefully this isn't... No, it's not a repeat. It looks similar to the ones I looked at yesterday and already today. Studies on psychiatric side effect post-COVID vaccination are limited. Making conclusions on vaccine advantages and disadvantages is challenging. In other words, we don't even have the information to then make the claim that these are so-called safe and effective. Vaccination is generally safe, but data suggest a potential link between young age mRNA and viral vector vaccines with new onset psychosis within 7 days post-vaccination. Yeah. Overall, 50%. Overall, 50% of patients achieved full recovery. Well, that means that 50% didn't achieve full recovery. And they had permanent brain damage, they were permanently paralyzed, they had movement disorders or whatever. So, again, when the entire population was essentially forced to receive this vaccine, and some people didn't receive the vaccine, but certainly the pressure was on for the entire population. When you're talking about injecting something into the entire global population, and oh yeah, by the way, we later discovered that some of these adverse events are going to include permanent paralysis and brain damage and psychosis, then that's a big damn deal. That's a big damn deal when you're exposing somewhere between, depending on the country, and some of them, like some of the Asian and maybe even Latin countries avoided this problem, but certainly some of the Asian countries did a good job of not receiving the vaccine. But in some of the, NATO countries, like the vaccine uptake was in the 90 percentages or higher. And now, 5 years later, we're finding out that permanent brain damage and psychosis are some of the adverse effects noted. Okay, so this is what I wanted to see in the other article that we didn't see, but now we are seeing in this one. So let's look at the presentation. This is perfect. This is perfect. This is exactly what I wanted to look at. So what are the clinical presentations of vaccine-induced psychosis? So this is good. So let's look at it. I'm going to highlight some of these. Anxiety, insomnia, hypochondriasis, auditory hallucinations, catatonia, and aphasia. This patient developed anti-NMDA receptor encephalitis. Auditory hallucinations, grandiose delusions, erotomaniac delusions, and anxiety. Unspecified psychosis. Let's see. So the first one was a 20-year-old female. Next one's a 31-year-old male. We have a 42-year-old male who developed, after the vaccine, anxiety, restlessness, agitation, irritability, low mood, insomnia, delusions, and loosening of associations. That's starting to push in the direction of schizophrenia. He was diagnosed with mania and psychotic symptoms. Now we have a 57-year-old male. Restlessness, anxiety, depression, nihilistic delusions. Hey, I have those all the time. So remember, I've talked about nihilism in some other videos. Nihilism, as Nietzsche has said, is, in one word, I'm kind of joking, but nihilism is basically seeing the world as worthless. What does exist shouldn't exist. What should exist doesn't exist. The cartoon version of that is, what is it? My heroes are dead and my enemies are in power. So anyway, I've never seen nihilistic delusions in a psychiatric assessment. That's pretty cool. Nihilistic delusions, irritability, insomnia, talking to himself. Hey, I guess a lot of us are guilty of that one. Suicidal attempt, mania with psychotic symptoms. Irrelevant talk. Hey, he could be an American politician. Oh, sorry, this is a female from India. Irrelevant talk, bizarre behavior, irritability, insomnia, delusions, persecution, catatonia, mutism, staring, rigidity, and negativism. Unspecified psychosis, pushing in the direction of schizophrenia. So this young man received the vaccine, and 2 days later, he's got unspecified psychosis with involvement of some of the deeper brain structures, apparently. Here's a 22-year-old female from the UK. She's disoriented, agitated. She's got hallucinations and hyper-religious delusions. Limbic encephalitis. Interesting. So again, those are kind of the deeper brain structures being involved there. So remember what I said earlier. Neuroinflammation can happen globally. We call that typically acute disseminated encephalomyelitis. Or it can happen just in the spinal cord. We call that transverse myelitis. Or it can happen in the peripheral nerves. We would call that some type of peripheral neuropathy. A lot of times it's labeled as Guillain-Barré syndrome. But again, depending on the patient's nutritional status, their other diseases, their genetics, that would determine where the inflammation takes place. If it's in the cortex, if it's in the deeper structures, if it's in the cerebellum, if it's in the brainstem, if it's in the spinal cord or peripheral nerves. So depending on where the inflammation occurs and the particular pattern of inflammation, that would determine, of course, what this presents as clinically. So I'll just go through the other ones pretty quick. 51-year-old male in the UK, 10 days later, unspecified psychosis. 45-year-old male on the same day. Wow. That's of note. On the same day, developed insomnia, unreasonable anxiety, tremor, disorientation, delusions, thought insertion, more delusions, and a suicide attempt. Wow. That's interesting. No previous medical history of any problems. Acute psychotic symptoms gradually resolved, and the patient was discharged from hospital with some apparently mostly recovered. So I'm just going to look at a few of these in terms of time frame. 1 month, a few days, 5 days, 5 days, 2 weeks after the injection, 1 month after the injection. Here's another one, same day. No previous psychiatric history. 18-year-old female, first dose. On the same day, she developed paranoid behavior, insomnia, fearfulness, smiling and muttering to herself, not responding to verbal commands, negativism, rigidity, mutism, and staring. And she had Guillain-Barré syndrome. That was oddly presented. And the reason I say that, if it's not already obvious, it'll be obvious to the doctors out there, for sure. But, Guillain-Barré here is peripheral nervous system. So those are peripheral nerves. But these problems are obviously brain. So she had brain and peripheral nervous system involvement. So, that's amazing. Here's another one, same day. Wow. So here's a patient. Let me just change the resolution here a little bit. Here's a patient with no previous medical history. This is a 40-year-old female from India. On the same day that she received the vaccination, she developed insomnia, fearfulness, suspiciousness, delusions, persecution, auditory hallucinations, and was diagnosed with schizophrenia on the same day that she received the COVID vaccination. Wow. That's impressive. Okay, well, that's, again, amazing. Review of neurological side effects from COVID vaccination, European Journal of Medical Research, 2023. The most important, according to these reports, vaccination can have an adverse event, especially on the nervous system. The most important and common complications are cerebrovascular disorders, including cerebral venous sinus thrombosis, transient ischemic attack, intracerebral hemorrhage, ischemic stroke, and demyelinating disorders, including transverse myelitis, first manifestation of MS, and neuromyelitis optica. Wow, that's impressive. These effects are often acute and transient, but they can be severe and... Sorry, let me reverse that highlighter. But they can be severe and even fatal in a few cases. Here we have provided a comprehensive review of documents reporting neurological side effects of COVID vaccines in international databases for only 2 years or 3 years. Well, it would have been the end of 2020, 21, and 22. So let's just take a quick look. You can, like I said, I'll put this article on the website. European Journal of Medical Research, 2023, like I said before. It's only 8 pages. Excuse me, it's only 8 pages long. And so you can see here some of the complications from the vaccines. Again, the underlying kind of common theme is obviously inflammation and immune activation, including the coagulation disorders. Another list, and then that's the end. And then they probably have some online archives because they said it was a review of international data. Psychiatric adverse events associated with COVID vaccines in Korea. A lot of these articles came out of Korea. I'm a bit surprised. So another observational study. Although this study had limitations, primary focus is that vaccine in an observational study design underscores the need for continued surveillance. Nobody has interest in doing that. Nobody gets money, for looking at adverse events. The money is in selling these drugs. And so, like I said yesterday, you've got two different types of surveillance for adverse events. Pre-approval and post-approval. Pre-approval data comes from who? It comes from the drug companies. They're obviously going to minimize the adverse events and maximize the benefits. That's called sales. That's what they're in business to do. The post-marketing surveillance, after the drug has been approved by paid-off politicians, the post-marketing surveillance basically doesn't exist and is completely voluntary and is completely unorganized in the vast majority of countries. So, let's say a patient develops psychosis or anxiety a month after they get vaccinated. That's not even going to make it into the database the vast majority of occasions. So, again, as I mentioned yesterday in more detail, basically, when we talk about this entire topic, we're just looking at the very, very tip of the iceberg. We're lucky that these even get published. Asian Journal of Psychiatry, I may have looked at this one yesterday, but I'm not sure. It could be the same journal, just a different publication. 2022, Psychiatric Adverse Reactions to COVID Vaccines, Rapid Review of Published Case Reports. Symptom onset within 10 days is pretty typical, so that warrants vigilance, according to them. And here again, they have a nice listing. So I didn't look at this article yesterday, but it's a good one for us to look at right now. I'm really impressed by the ones that occur within the same day. That's amazing. So, take a normal, healthy person, give them the vaccine, and the same day they develop psychosis. That's just, or even the next day. So let's look at same day and next day. Altered mental status. 1 day later, headache, high fever, distant history of brain injury. Let's see, what was the, they don't really provide a big description here. Psychosis occurring on the same day, irritability, irrelevant speech, decreased sleep, delusions, visual hallucinations. Here's another one, same day. Mania with psychotic symptoms on the same day as receiving the vaccine. Amazing. Here's another one. Functional neurologic disorder occurring on the same day. Same thing here. Unilateral arm weakness. Another one, unilateral face weakness, or hypoesthesia, meaning lack of sensation. Amazing. Functional neurologic disorder. So these people are basically neurologically impaired the same day they got the vaccine. That's amazing. This is a somewhat complicated one. new onset psychosis, acute psychosis, as a manifestation of lupus cerebritis following COVID infection and vaccination. So this is a complicated case. So let's just look at it real quickly, if I can. 26-year-old female, family history of schizophrenia, but no personal or medical psychiatric history. Diagnosed with mild COVID 4 days after receiving the vaccine. So she got a double hit. She got a so-called wild infection, and she had the vaccine in her system at the same time. That's going to be what we call an inflammatory soup, and that's going to be a big mess. No surprise, a month later, she's got neuropsychiatric problems. Brief psychotic disorder. And then she starts to kind of fall apart. Severe weakness, dysphagia. So she's having a hard time eating and swallowing, probably. Neurologic evaluation revealed dysarthria with left hemiparesis. So she probably has spinal cord involvement or brainstem involvement. Brainstem is what I should have said. Acute kidney failure. Wow. Acute kidney failure, proteinuria, a lot of inflammation, pancytopenia. Antinuclear antibodies. Left frontoparietal lobes and the cerebellum. Patient was diagnosed with lupus and psychosis. Well, you can look at the details of that. Post-COVID Guillain-Barré syndrome, not too surprising there. I'm not going to talk about that. It's just peripheral neuritis, basically, and that's inflammation of the peripheral nerves. And that can happen from a lot of different causes. Sometimes it's a gastrointestinal infection, sometimes a viral infection, but also vaccines. I started to look at this one. So this is the last article that I pulled up yesterday before I needed to take a break. Published in 2024, apparently. Autoimmune encephalitis, post-vaccination, again, with post-vaccination overlapping with a natural infection, looks like. And this patient apparently already had narcolepsy, which could have been another adverse response to a vaccine. Yeah, so that's a very unfortunate case. Let's see a few more. Acute psychosis due to NMDA receptor encephalitis following COVID vaccination. So another example. And I guess that's the end of it. This is a different article that I'm looking at for other reasons, but also related to neuroinflammation. So, that was a quick overview, so to speak, of 22 articles related to neuroinflammation and acute onset psychosis following one of the COVID vaccines. So, again, as these vaccines were pushed on the global population, you never heard Anthony Fauci warning you about potential psychosis, paralysis, permanent brain damage, schizophrenia, anxiety, depression, and, nihilistic delusions. So, that's the problem with pushing these drugs so fast and so widely on the global population. They have no idea what they're going to find a couple years later. And now they're finding, major neuropsychiatric consequences of these vaccines. And again, if it's a rarely used vaccine like the yellow fever vaccine or something like that not everybody gets, then that's one thing. But when you're talking about a vaccine pushed on the entire global population, sometimes at 95% uptake in some countries, and then, a couple years later you find out that it can cause, psychosis and permanent brain damage, then that's a big damn deal. So again, I'll put these on the website. Eventually I'll do a part 3 to this series. It'll be short, but I did think of one additional step that we could take in this conversation. I just thought of that this morning. So at some point in the future, I'll talk about that. So again, What's the biological plausibility here? Neuroinflammation. What is neuroinflammation? You've pissed off the microglia. They produce more cytokines and more glutamate. The astrocytes say, screw this, I'm not going to play this game. They're not going to pick up the glutamate. Then you get way too much glutamate that activates all of the glutamatergic receptors in your whole body, but especially in the neurons. One of those that we're particularly concerned about is called the NMDA receptor. That allows calcium to enter, and that creates a big clusterfuck within the cell because we call that calcium overload, or what I called back in 2006, intracellular hypercalcinosis. That leads to more inflammation, more mitochondrial dysfunction, and neurodegeneration. So, again, that can be triggered by infection, it can be triggered by vaccination, and it can be triggered by trauma, stress, and an ultra-processed food diet. So we have lots of ways to get there. But what happens if a patient is stressed out, consuming ultra-processed diet, sleep deprived, depressed, and then they get vaccinated? So if you put all those additive stressors, and that is how neuroinflammation works. So neuroinflammation can happen in a linear sequence the way that I described it. Microglia, astrocytes, neurons. But if those microglia are, as we say, primed, so they're already irritated, they're already inflamed, and then we add another insult on top of that makes things much worse. So, and that's a good chunk of the population, but what chunk of the population is it? It's mostly poor people. Stressed out, sleep deprived, eating junky foods, and then they get vaccinated, so then they could get a free, ticket for a donut, and that's an inflammatory soup, as we say, that promotes additional depression, anxiety, cognitive impairment, all the way to potentially psychosis, seizure disorders, paralysis, things like that. So this is an important topic that deserves some level of attention, and that's why I talked about it now in these two different videos. Hope you're doing well. I'm going to bring this to a close. I'll get this on the website as soon as I can. Hope you're all doing great, and I'll talk to you soon. I actually want to talk about some diet-related conditions and new data. That's going to be rather painful to read, but I'll try to get through it really quickly, and I think it's important to look at this stuff, So I'm going to take on the responsibility of reviewing that information, even though it's going to be a bit painful for me. I'll try to make it easy for you. But I do think at least 2 new articles that came out recently are worthy of review, even though they're big, chunky articles. Hope you're doing well. Take care, and talk to you soon.